What are some things that you may not realize about plastic surgeons? Well, I can only speak for myself, but here's some things that I think you might think are of interest. I had my first paying job when I was 34 years old. I was in university for 16 years, and I really didn't start making any money because I had to pay off debts until I was nearly 40. I get up at 4:30 every morning. I leave the house at 5:30, and I often don't get home until after 7 p.m. So I really only have a couple of waking hours with my kids before we all need to go to bed. I wear scrubs that correspond sometimes with my mood, but also a color that won't get dirty during surgery. For instance, sometimes with liposuction, there can be a little bit of blood-tinged fluid that can fall down the drapes, and if I'm wearing light-colored scrubs, I don't want to get them messy. Plastic surgeons don't always get to eat lunch because we're really busy, so I eat a really hearty breakfast that usually involves leftover dinner. Lasagna, pasta, and leftover pizza and meatballs are usually my go-to breakfasts. I wear really comfortable shoes. I used to wear clogs, and before the pandemic, I would wear a dress and heels, full makeup, and nice jewelry when I was greeting patients. Nowadays, since the pandemic, it is comfortable shoes that are machine washable. I have several pairs of these, Amazon purchase, and they really help your feet not hurt so much at the end of the day. We ask our patients not to wear strong scents when they come to the office. Some of our patients and some of us are very sensitive to strong smells because if a patient is wearing very heavy cologne, sometimes it can trigger a migraine, as unfortunately it did today for me. And finally, plastic surgeons do their best to really understand their patients. We tend to become very good listeners. We try to be empathetic because patients are entrusting us with their bodies, their body image. It's very directly related to self-esteem. So a lot of what we talk about to patients really has nothing to do with surgery, bleeding, suturing, drains, all that. It really has to do with how patients feel about themselves, what they see when they look in the mirror, but also when they look down. We really have to put ourselves in our patient's shoes. And fortunately, I think I'm pretty good at doing that. At the end of the day, especially after having a lot of consults, talking all day, doing a ton of educating, reassuring, hand-holding, giving lots of hugs, I'm really exhausted. And I often crash and go to sleep and get a really good night's sleep so I can do it all over again the next day. For more information about me and my practice at San Francisco Plastic Surgery, visit my website.